All right, is everybody ready? Nope. Just checking. I'm gonna be here, all up here by myself. Thank you guys for joining us today for our. Is everybody ready? I hear myself now. Just checking. I'm gonna be here, all up here by myself. Thank you guys for joining us today for our.
I think Scott has some reverb going on, but I want to thank everybody for joining the Warren webinar today. Scott's going to work on advancing us some slides here and get things going.
I do actually. Hold on one second. Okay. So during today's webinar, you're going to be connected via Zoom. So you'll be able to interact with presenters in a variety of ways. So through chat and Q&A. During today's webinar, you're going to be connected via Zoom. So you'll be able to interact with presenters in a variety of ways. So through chat and Q&A. Please provide feedback and exchange information via the chat box. In your chat, you'll notice on the chat along your bottom toolbar, there is an option for changing it to all panelists and attendees. So you can see everybody's comments throughout the webinar. You'll notice on the chat along your bottom toolbar, there is an option for changing it to all panelists and attendees. So you can see everybody's comments throughout the webinar.
I think what we have going on, I think somebody's computer is on a little bit of a delay, and the speaker sound is coming through the mic sound. So
I'm trying to fix that. That's me.
Oh, okay.
I don't know if you guys just want to move forward and I'll mute myself.
Yeah,
Okay.
that's fine, Scott.
I'm sorry. I'm trying to yeah. It worked well in practice.
All right, as Scott mentioned, as Scott mentioned, if you'll set your setting to all panelists and attendees so that everyone in attendance can see the question, and that'll enable us to obtain an answer for you. Next slide. You'll have two options today for interaction: is the Q&A box as well as the Zoom webinar chat. The question and answer can be initiated at the bottom of your screen, and you can type your question in, and we'll be monitoring that through the webinar to be able to provide answers to any questions that come in that way. If you're connecting via YouTube Live, you can interact with the presenters by the chat box located on the right side of your screen. That'll be monitored and conveyed to the presenters. There is a delay on YouTube Live, and so you will be hearing things slightly behind the rest of the folks listening on Zoom.
And we will try to help you YouTube Live folks out by repeating any questions that get posted, because you probably won't be able to see them in the chat box, and then sharing any answers as best we can throughout the webinar. Okay, Scott, back over to you.
All right. Today's webinar is being recorded. We make the recordings available on the Virginia Warren website after the conclusion of the webinar. And so you can also check the vawarren.org website for future webinar informations and postings. And with that, Ike Eisenhart is our current chair, and we'll turn it over to Ike to get us started.
All right, I want to thank everybody for being here today. You can go ahead and advance to the next slide, Scott. Thank everybody for being here today. All of our state partners that have joined us, all of our Virginia Warren members that are on, all of our utility partners. I mean, this is basically for you. Well, it is for you and for all of us to learn and to help. And any additional VA partners that might be on, Virginia partners that might be on in the way of consultants or maintenance folks or anybody like that that's out there helping us. We've got some good speakers. Before we turn it over to them, I kind of want to address a couple things without turning this into a political piece. We need to address the fact that we do have civil unrest going on. We understand that. And we need to make sure that we're looking at employee protection, how we're staging our equipment, making sure we're working with local law enforcement before we go into an impacted area, keeping our people safe as best we can. On top of COVID, the civil unrest, today is the third day of hurricane season in Virginia. And we've already seen that this is going to be a very active hurricane season. So we want to make sure that we're using our best business practices to prepare for that. We're going to talk a little bit about some of the phase 1, phase 2. Part of Virginia is going to be moving into phase 2. There's 1 or 2 localities that are not going to move into phase 2 at the same time. We're going to touch base on that. So this is going to be a very busy next couple of weeks, next couple of months, summer season for us here in Virginia, as well as the rest of the nation. And one thing I do want to talk about as we go through the slides, as we see our COVID levels start to level off, that doesn't mean COVID has gone away. So we still need to be exercising some due diligence, some patience and practices there. ODW had put out before on a couple of our webinars that they're working with utilities to give out certificates of appreciation, notice for anybody that's worked through the COVID, should you request them as part of their morale and welfare part. And they've already seen some people reaching out to them and requesting some of those certificates. So I want to thank all those that are reaching out to ODW, and I want to thank ODW for doing that for us. That's a great thing. With everything going on right now, we need to also be thinking about the fact that we're starting to hit these tension points, both with our employees and with their families. I mean, there's a lot of stressors right there. We need to make sure that we have some good community programs in place to start looking out for that health and welfare piece, especially that mental health piece for all of our employees that are dealing with dealing with COVID at home, the civil unrest, creating stressors at home, kids, significant others, family members, all that's binding down on our employees. We need to make sure we're staying aware of all these things. So like I said, I just want to kind of high level that, make sure everybody's on the same page. And with that, we're going to move into our presenters. Scott, if you can move to the next slide. All right, so our first presenter is going to be Dr. Marcia Deegan. She is with the Virginia Department of Health. She's an environmental technician service manager, and she's going to talk to us a little bit on what's going on with the COVID program and around wastewater, about doing some sampling. And then we're going to have Dr. Raul Gonzalez, who's an environmental scientist with the Hampton Road Sanitation District, and he's going to talk about what they're doing with this, their piece within the study. So Dr. Deegan, I'm going to turn it over to you, and we will watch the chat and let you know if we have any questions.
Well, thank you. Appreciate it. Greatly appreciate the invitation to come talk with you all today. I'm going to basically give you a little overview of wastewater epidemiology. You'll also hear other terms used. Some people call it wastewater surveillance, molecular source tracking. But basically, what it is a discipline that uses markers in raw wastewater to gather data on the population within a wastewater catchment or sewer shed. Now, sewer shed monitoring has been used to track the prevalence of opioids. I think we all heard some articles and some papers on that last year trying to track the opioids with the crisis in that arena. It's also been used for other pharmaceuticals, Zika, SARS, norovirus, and it's also been used in long-term surveillance for polio. As a matter of fact, as recently as 2013, 2014, a wild polio virus type was detected in sewage in Israel. And it was detected in the sewage before the clinics had any cases. In that event, Israel was able to launch a vaccination campaign and contain the virus, and they actually had no cases of paralysis as a result. Next slide, please. So as you know, a sewer shed is very similar to a watershed as far as what it looks like. We have increasingly larger piping as you move from the upper reaches of the collection system down to the receiving water. So we accumulate flows as we move through. Now, if you were searching for I&I in your system, you would systematically eliminate branches through flow observations until you hone in on the I&I source. Similarly, with wastewater surveillance, you can sample at the influent to the receiving plant for viral particles. Thank you. Now, you could stop at that point and conclude that you have infected people in the population. Or you could also go ahead and move up the sewer shed and systematically sample until you identify the source of the infection. So in this little graphic, the green means that as you moved up, you checked that branch and everything was fine. And then you find you still have an infection showing up in the main course. So you keep going up the sewer shed until you identify the branch that has the highest, that still has a signal in it. Next slide. So when we talk about sampling COVID-19, we can do that because it is shed in the feces. Now, most studies to date suggest that the shedding virus is not viable. So when we sample for COVID-19, we are sampling for fragments of the RNA that is left. The virus itself, I just also want to mention, the virus itself is highly susceptible to standard disinfection methods. So we are not worried about COVID being in the effluent of a well-run treatment plant. Now, unfortunately, one of the things that we don't have is the rate of shedding over the course of the disease. We're getting more data is coming in every day. But because this is a key parameter in being able to convert those viral concentrations in sewage to approximate number of infected people in the watershed, this is very important. So there's a certain amount of uncertainty around some of the projections, but we are learning every day, and those projections are being refined as new data comes in. So now the sampling itself, it's done using a PCR method, and we are measuring the viral particles, as I mentioned. So this PCR, it's polymerase chain reaction method. It analyzes short sequences of RNA, and then it reproduces or amplifies those selected sections so that you can measure even very small amounts of RNA in a sample. So while PCR itself is well known and it's well documented, the application of this process to wastewater for COVID-19, it's not standardized. You can't pick up a book of standard methods and find that methodology in the book. Now, the Water Research Foundation is working towards identifying best practices. They've held several webinars, have had several conferences on this topic to identify best practices with respect to things like sample type, sample storage, location of the sampling. And then they're also looking at the effect of the wastewater matrix on the virus. Does it affect the viral signal as it moves through the sewer shed down to a sampling point? Next slide. So with all that said, though, we have pretty good data. And part of the reason we have pretty good data is we're able to apply methodologies from similar viruses to this and to be able to make some projections. Now, this data is taken from the Netherlands, and this is the one that was reported so frequently in the news. And this was pulled from the Water Research Foundation event, which was the Virtual International Water Research Summit on COVID-19 at the end of April. Now, on the left-hand side, you see the number of reported cases per 100,000. And on the right side, you see the gene copies per 100 mil. And then we have time across the x-axis. The solid lines are the number of reported cases. So these are the individual infected people. And then the small dots show the RNA fragments. So there are 3 different RNA fragments that are being reported here. And you can see that they track very well with the cases. The other significant thing about some of the Netherlands testing is that they reported a signal in the wastewater a week before any cases were reported. So it has the potential to give us a kind of like an early warning system. So it's this type of correlation and this type of information that's prompting VDH to look at this testing a little bit more closely. Next slide. So when you look at wastewater surveillance, and if we compare human testing to wastewater testing, you begin to see that there is a good argument for wastewater testing. We've all heard about the limitations of being able to test individual patients. Our testing is limited. We can't test the whole population. However, when you sample at a wastewater plant, you are capturing a large population. So you're able to tell on a general large scale something about the community health. The other thing about human testing is the time factor. There's a delay in determining that an infected person is positive. You've got 2 to 14 days for the person to become symptomatic. There's time for them to go to the doctor. There's time for them to decide that they need to get tested. Then they get tested. Then we wait for the sample results to come in, and then they get reported. And this shows up in the table on the bottom, in the graphic on the bottom. This is off of the VDH website, and it's confirmed cases by date of symptom onset. And so we're moving through time, going left to right. And you'll notice that on the left-hand side of the graphic, we're very confident in that data. But as you move towards the right, you'll see that it is grayed out. And if you could advance 2 times on the slides. So the data to the right that is grayed out are the things that we are not sure of yet. We're waiting on the data to come in. So we have 3 to 4 weeks of uncertainty as to what the true number is. Whereas if we were looking at wastewater testing, in addition to this, the infected person begins shedding virus in their feces within 2 to 3 days based on some of the testing that we have. So we would pick up that signal a whole lot earlier than we do with individual testing. Next slide. And next slide. So we are extremely interested in this information, but we also recognize that it's a newer science and there's gaps in the knowledge. There are items that are needed to refine the technique and increase the accuracy of the projection of positive viral cases from this work. And some of those things are the rate of fecal shedding. It is being refined. We need consistent methods for sample collection, storage, and analysis so that we can normalize the data and be confident in them. We also have those unique challenges working in wastewater. There's low recovery rates of the virus itself. So it takes special techniques in order to run these tests. There's also interferences, some of which are not known in wastewater. And we need a consistent method to be able to translate the viral load to infected populations. Now, There are efforts underway to address these issues. Their CDC is working on what they call their Phase 1 project, and they're working with collaborators like Hampton Roads to answer some of these questions. Additionally, Water Research Foundation, as I mentioned earlier, has been very involved in this, and they just sent out, it's either this week or the end of last week, a call for laboratories to participate in an interlaboratory and methods assessment for the SARS-CoV-2 genetic signal in the wastewater. So a lot of people are working on this topic. Next slide. So the Department of Health, we want to better understand the virus. We want to understand its spread and how data from wastewater could be used to improve public health in the Commonwealth. So this is where we are at the moment. We are, tracking disease prevalence through wastewater surveillance is a relatively new science, and COVID-19 is a new virus. But surveilling wastewater for COVID-19 may provide some additional information to do things such as inform reopening decisions or signal a resurgence of the disease. So if we think it might drop in the summer, if we could be monitoring wastewater in the fall, we might pick up that signal earlier if it does come back. The other thing is, in order for wastewater surveillance to be used, it has to be widespread, it has to be frequent and long-term. Single grab samples in time don't tell us much about the overall community health. So we would need to have a more long-term consistent survey. And VDH is monitoring the CDC progress in developing these consistent guidelines. So we are in a monitoring standpoint. We have been working closely with HRSD and monitoring their data and what they have been working with. And at this point, I'm going to turn it over to Dr. Gonzalez so that he can share with you what HRSD has been up to.
Thanks for that great introduction and background into wastewater epidemiology. That allows me to just jump right into our data and present a high-level view of HRSD COVID-19 wastewater data that we've been collecting the last 4 months. Next slide, please. But first, a little background about myself. I'm an environmental scientist for Hampton Roads Sanitation District. Specifically, I run Hampton Roads Sanitation District's molecular pathogen program. It comprises a group of field scientists as well as a molecular laboratory. And in this molecular laboratory, we have digital PCR, which is our preferred quantification method, quantitative PCR. Those essentially quantify molecular markers in different matrices. We've also gotten into DNA sequencing. We have 2 DNA sequencers in-house. And of course, we do run some of the more traditional culture-based methods. And these include culture methods for certain viruses. We've been using these methods for the last 6 years in various matrices like wastewater, biosolids, stormwater, sediment, shellfish, and now even air samples. But throughout the last 6 years, our projects have really focused on microbial source tracking DNA markers, and eventually those projects kind of evolved in complexity to more pathogen quantification projects. So we started with DNA bacterial pathogens, eventually progressed to DNA viruses like adenoviruses, and even RNA viruses like noroviruses. And it's been that progression and that experience with quantifying these markers in wastewater that really put HRSD in a good position to quickly and efficiently start generating COVID-19 data for our region. Next slide, please. So just to give you an idea of when we started, I put our sampling date or our kickoff date on this COVID-19 timeline. I think a lot of people in this call already know that, the first patient kind of developed symptoms in early December. By January 11th, the first person died due to complications of coronavirus. The first death in the United States from COVID-19 occurred in late February, and then a few weeks after that is when the WHO declared COVID-19 a pandemic. Interestingly, it's that same week HRC started analyzing its first wastewater samples. But of course, we started the discussion and the preparations for that first analysis in about mid-February. Next slide, please. So originally, in about mid-February, when we started internally to discuss how a study would look like, a COVID-19 surveillance study would look like, our original goal was to use this as a proof of concept and a pilot study with intention to fill just internal knowledge gaps on whether we could even do this, and this is a viable concept, and whether we can apply this to potentially future outbreaks, like seasonal outbreaks like the flu or norovirus. But within weeks of collecting data and various meetings, we adjusted our goal because we realized, yes, we could do this, and we can actually help generate data that could be used during this pandemic. So we refined our study goal to capture the rise and fall of COVID-19 cases in our community here in Hampton Roads, with the specific objectives of describing the occurrence, the trends, so rise and fall of the SARS-CoV-2 virus, which is the virus that causes COVID-19 in our region. A secondary objective was to assess and I know you guys can't see my fingers here, the true prevalence of COVID-19 in our watersheds. As Marcia mentioned, there's a large number of asymptomatic infections that in our community that do have the potential to spread the disease, and so I think getting an accurate prevalence estimate would be very useful. Next slide, please. So I do want to I know it's been said a few times, I do want to just hammer home that we're not detecting whether this virus or the viability or infectivity of this virus. What we're actually detecting is the RNA or the genetic material of this virus, and we're just really using that as forensic evidence for our community. The data I'm going to be showing on the next few slides, is part of our weekly monitoring of our 9 major facilities. This monitoring started in the second week of March, but we are also monitoring our final effluent of some of our facilities, as well as our SWIFT final samples. I know that Marcia earlier kind of showed a figure with these assays, these tests, these CDC N1, N2, and N3 assays. That's what we are currently using here at Hampton Roads. So we, early on in about February, adopted or validated CDC's diagnostic test to wastewater. And from the very beginning, we made sure to engage the health department and share our data as it was being generated. I do want to acknowledge our other collaborators. We can't do this alone, so we've been in communication with risk assessors and environmental engineers across the country, as well as some recent communications with the CDC. Next slide. I'll go ahead and jump right into the data. The easiest and more simple way that that you could look at this data is just the occurrence of the occurrence and the concentrations of these viruses in wastewater. So with the top panels here, each panel is a week. On the y-axis, hopefully everybody can see it, is the concentration in genomic copies per 100 mil, and along the x-axis are our treatment facilities in alphabetical order. So we are running three, so these three CDC tests, N1, N2, and N3, and we don't normally run 3 tests in wastewater for one marker. So this is our simplistic way of just looking at occurrence. You'll notice in the first week, which was March 11th, we did see detection of our markers in 3 of our facilities. During this week, I believe we had 2 confirmed cases in our region. So that answered that first question: can we see this in wastewater? Yes, we can. And then as you look at the panels progressing, you can see that we could actually even document the spread of this virus in our community as it's spreading through the different plants, and you could see changes in concentrations as well. At the bottom right of this figure is a red line that just kind of shows the trends in total detections over time. That might be a good way to view this data as well, if you can't see the individual dots. So already, just by looking at the concentrations, you can see that we're already answering questions. Yes, we can see the virus in wastewater. Yes, we can see trends. Yes, we can see significant jumps, like from week 1 to week 3. You can see that total detections across our region in Hampton Roads went from 3 to 15 total detections in just 2 weeks. So absolutely, this can be done and then be helpful. Next slide. But there's a lot of, this is such a new concept. We really, there's a lot of other information that you can take from, I'm sorry. There's a lot of other information that you can pull from this data set. What I'm showing now are each panel is a treatment facility, so one of our 9 major facilities, and on the x-axis is time, and on the y-axis is population normalized load. So that's actually not just the virus concentration, but that's the load of the virus coming into the plant, normalized by how many people are in the sewer shed. And we found that this was a really good way to also look at trends, but look at trends in terms of the total load. So I'll call out just a few panels here. I know it's really hard to see in the next slide. I'll zoom into a few, but if you look at the middle panel, that's our Nansemond facility. In about mid-April, you could see that we had a really sharp peak. That corresponded to an outbreak that we saw in Isle of Wight. If you look at the panel to the right of that, you can see an earlier peak. So that's the WB panel. You can see an earlier outbreak that happened in James City County. So you can match up our data with some of the clinical data. Next slide, please. But there's more trends that you can see and pull out of this data set than just outbreak data. So in this these 2 zoomed in panels on the left, that's our one of our facilities here in Virginia Beach. And what you're seeing here is a fairly consistent signal across time. I forgot to mention this earlier, but the dark circles are based on detections of the virus, like the detections that I showed in my first results, and the open circles are actually based on non-detect. So we use the limits of detection in place of that non-detect. So you can see this consistent trend in that figure on the left in Ches Liz, and on the right This is another treatment facility that actually has 4 hospitals inside of the sewer shed, and you can see for the first 2 weeks we saw non-detects of our markers, and then by the 3rd week we saw a significant increase in load, and then a steady decline through May, and then in the last 2 weeks we've seen kind of this jump in load concentration. So, we find that visualizing the data in terms of these normalized loads can provide, more trend analysis. Next slide, please. But of course, there's nothing like seeing your data on a map on a spatial scale. So we produce weekly maps of the normalized load data that I showed previously over the actual catchment areas, and each one of these panels is a week's worth of data, and you can see the progression of the virus spatially through Hampton Roads, and you can point out high density hotspots. I will next slide, please. I'll just zoom in on a few of these that I picked. I think I mentioned the Isle of Wight outbreak earlier. In this first panel, you can see. Oh, I'm sorry, a James City County outbreak earlier in the first panel. You can see it was clearly highlighted there. That's what the data was showing in a previous figure. And it looks like this last panel, end of April, you could see another hotspot at one of our facilities on the South Shore. So we really like watching or visualizing the data in these ways because, it a lot of times if you're not used to visualizing wastewater molecular data, some of the patterns and trends get lost. So visualizing like this is we find to be very helpful. Next slide. Of course, I've been showing catchment-specific data up until now, but of course we can view the data regionally by combining all the data. So this is, again, population normalized viral loads, but for all of our treatment plants. I do want to point out on May 5th, it looks like there's a sharp decrease in data. That's an artifact of us needing to rerun some data. So that dip is an artificial dip around May 5th right there. But this is a time series of that population normalized viral loads that we were viewing by catchments earlier. This is the type of figure that in the future we're going to try to match up with clinical data. And next slide. And of course, earlier in our objectives, I mentioned this true prevalence. So we are working with a lot of collaborators on trying to determine true prevalence in the community. This was an early take on this. There's a lot of uncertainty in these prevalence estimates now, and it's because we're missing a lot of data because it hasn't been generated yet. There's some clinical data that at some point will be coming out that will help us dial in and reduce the uncertainty in these prevalence estimates. But this was an earlier attempt at calculating prevalence in Hampton Roads. So on the x-axis you have time, and on the y-axis you actually have prevalence normalized by population. And the bottom part of this figure, like the bottom edge, is actually the median. Is the median value, and the top edge is a worst case scenario. But these type of estimates carry a lot of uncertainty, and there's a lot of people, including ourselves here in Virginia, that are working to try to improve these estimates. Next slide, please. That was it, and I think I'll be happy to answer any questions at the when appropriate.
So this is Marcia Dagan again. Do we want to do questions now, or do we want to do these questions? That's a question.
I'm going to leave these questions up for people to review. I'm going to ask a couple of the questions that popped up in the chat real quick for both of you, because I know your time is short with us. So one of the first questions as it shows up is, has anyone been able to extrapolate population percentage existing COVID shedding from this data?
Oh, I think so. That must have been asked earlier in my slides, because at the end I just showed that yes, we are absolutely. I mean, that was an early objective, and that still is an objective. There's just a lot of uncertainty in those calculations, and but there definitely is an ongoing effort, not just even at the state level, nationally and globally, that to try to dial in those models. So yes.
Okay. And then I've got some people answering the question as you have it posted there, Dr. Dagan. So also, let's see here. Scroll through these and try to get these real quick. So is the uptick in the mid-May correlated with the relaxation of stay-at-home orders? Do you guys think that uptick that you were seeing, do you think that had anything to do with what was going on with stay-at-home orders? Could you go back a few slides so I can see where they're dating? I know that we haven't gotten there yet. Oh, you know what? I think you passed it. I think maybe it was, if we look at that regional slide, that might be really, yeah, right there. The mid-April uptake was actually before stay-at-home, or I'm sorry, that was before the relaxation of the orders. But we're definitely still way too early in our analysis to say anything definitive there. I think we're still, we're still sharing this data with the health department and other collaborators, and have yet to really line up some of that clinical and behavioral data to our data. But that's happening now and in the future. Okay. And we had some people ask if you'd be willing to share your PCR method.
Oh, absolutely. It's already up on the website, but I'd be, if anybody shoots me an email, I can just send it to them. I've posted it on various websites. We are working on a document that hopefully will be out shortly, just kind of getting some final approval. But I'd be more than happy to send the actual digital PCR method to anybody. Of course, there's, it's probably specific to our particular instrument, but we'd be more than happy to help with any optimizations or method questions.
Gotcha. And then I think this is going to be to both of you. Would this testing be a valid mechanism to test a specific population that thus far has 0 cases identified, such as a gel, a water plant, etc., to identify the COVID positive but asymptomatic individuals are present? I think that's supposed to be, but that have asymptomatic individuals are present.
Sure. I mean, I think this would certainly at least this would indicate that there is somebody in that population or within that building that is shedding virus, and it could be before they are symptomatic, or you may have asymptomatic carriers that would be picked up by this method.
Gotcha. All right. And then for those of you on YouTube and that haven't been able to answer this, the posted question right now is, would you be interested in a broader discussion of wastewater surveillance with VDH? And the second question is, if CDC completes guidance on sample collection and analysis, would you consider following that guidance and sharing your sample results with VDH? And we've had a couple people say that they would definitely be interested in doing that.
And I
do you want them to email you? Oh, sorry, go ahead.
Oh, no, I just, with regard to the sampling and this whole question, I just want to reiterate that, VDH is at the point of trying to better understand, the virus, how it spreads, how we can use the data from wastewater to improve our community, our public health understanding. Any data that would come in you know, there's nothing that we can act on. There's no enforcement. There's no there's nothing that we could do to somebody with this data. It is mainly to help develop the science so that we can look at trying to develop this into a tool that we could use at some point in the future. There's no specific plans. We have no source of funding dedicated to this. We are basically trying to gauge the interest in the technique at this point.
Understood. So if people are interested, do you want them to email you directly, or how do you want that information gotten to you?
I think we have a poll questions to launch, which should capture.
Correct.
Right, and I understand the poll questions will capture that information.
Perfect. We can get Scott Smith will post the first one here. For our YouTube viewers, listeners, would you be interested in a broader discussion of wastewater surveillance with BDH? And your three answers are yes, no, or does not apply. And we'll give you a second or two to answer that. Some people are stating this could be significant information too, as pertaining to medications that are effective if used in certain communities. And we have somebody asking, how do you correlate data from single sample point to its spatial coverage? Is the area that wastewater being collected? Is it that? Yeah.
Yes. Yeah. So we are basically monitoring anybody who is using that collection system. So that becomes our spatial area that we're looking at. There were also a couple other questions about, can you use this to project when you're going to have herd immunity? Does it, if you don't have infected populations, how does it pick it up? I mean, not infected, but if you have asymptomatic people, does this pick it up? One thing to remember about this methodology is you're sampling wastewater and you're getting essentially a concentration. And then that concentration, we have the data that Raul is projecting is based on how, when somebody is infected, how much virus do they shed? It is not based on the number of known cases of infected people. We haven't done that correlation yet. So it is truly just the raw sampling of that population. And so it doesn't care if you're asymptomatic. It doesn't care if you weren't diagnosed or not. It's going to pick up the virus regardless.
All right, so from our first poll question about would you be interested in a broader discussion, 76% of the people answered said yes, 7% said no, 17% said this does not apply. Okay, can you put up the next poll question, Scott? David in chat said, so this could possibly be a future early warning mechanism for a nursing home or other facility question. All right, and our poll question, and we'll come right back to you, David. Our poll question, if CDC completes guidance on sample collection and analysis, would you consider following that guidance and sharing your sample results with BDH? And your answers are yes, no, or does not apply. And then Dr. Deegan or Raul, do you want to answer that question David just posted while we're waiting on these answers?
Oh, sure, absolutely. I work for a wastewater utility, and us and the municipalities do have access to move up in the sewer shed, kind of how Marcia diagrammed earlier, and collect samples that are more specific to a location or building or a neighborhood. So absolutely, that is absolutely possible.
Scott, do we have our answer? Oh, yep, there we go. So for this one, as CDC completes guidance, would you be interested in sharing your sample results? 68% said yes. 2% said no. 29% answered does not apply. Okay. Do we have a third question on this particular topic?
No, this is it. Thank you very much. I appreciate that.
Okay. All right. So when we get to the end of the slideshow, here's the information. If you guys are interested in participating in those, emailing one of these two, or you can email those of us on the WARN, but it'd be quicker for you to go straight to either Dr. Deegan or Dr. Gonzalez. We'll leave that up for a second, and we're going to try and close out these last slides. We're pushing against our 2 o'clock timeline here. All right. So the current status of the pandemic, you can go on to the next slide, Scott. And just for those of you that are listening, Dr. Deegan and Dr. Gonzalez have to step off at 2. So if you have any follow-on questions, you got a couple minutes to get them in. Otherwise, we'll have to email them to them. All right. So COVID-19 map. This is where we are right now. Total cases in Virginia have been reported at 46,905. Our total hospitalizations have been around 4,884. So this is pretty standard. This is right off the VDH COVID-19 map. Scott, if you can go to the next slide. Here you're starting to see that we're starting to come down on the back side of this number of cases by date of symptom onsets. So we're starting to see it's starting to come down. We're anticipating that we're going to see some change in data just based on the fact, especially around the civil unrest, nobody's really maintaining social distance during this time. So I would anticipate in another week or so, we may see another quick little surge going up. But as of right now, the trend is looking very good for us. Okay, Scott, next slide. Scott Shirley, did you want to speak to this slide here? This is the one that we've been talking about with the...
Sure. We've received a number of questions related to surveillance of COVID related to recovered individuals. As we've answered in the past, that's data that's not collected by VDH or presented on the website. There are a couple of other options that we have posted to the WARN resources page that do show recovered individuals. This is specifically University of Virginia's model that's been developed for Virginia-specific data. And so as you can see, it's listed currently as 6,011 individuals recovered. So for those that are interested in that data, this is a particularly useful website on the UVA dashboard.
Next slide, Scott. There you go. Mr. Shirley.
Sure. This is basically the chart that we've discussed, another representation from IHME. The top line are the number of tests being conducted. The bottom line is confirmed infections. And if we want to go ahead to the next slide. Where this matters, it provides some detail on the positive test rate. And so as you can see, Virginia's, it's trended as low as close to 10% up to this 11.4. International guidelines indicate that you have sufficient testing to front-run viral spread if you're at 3% or less on your positive test rate. So with Virginia continuing to trend at this 10 to 11%, I think it makes it that much more important on the discussion of things like wastewater surveillance and alternatives to testing, because we're still trending at 11.4%, which indicates a potential challenge on being able to contact trace and control infection spread. Also in this, you'll see the infection rate. This is another website we've posted as a resource. The infection rate The goal from social distancing and all of our activities is to take the infection rate to below 1. If it's below 1, that indicates you will begin to see a decline in overall cases. As long as that rate stays above 1, you will continue to see the escalation of cases, which we've more or less seen in the infection rates reported daily. And so Virginia's not trended below 1 at this point. Obviously, we got fairly close in an earlier stage, but this shows kind of current status. The last piece, contacts traced. This, and if you go to the website, it explains this in greater detail. This is based off the number of contact tracing personnel VDH currently has. Obviously, there is an effort to surge the number of employees conducting contact tracing. And so at this point, I'm not sure that this is very useful data, knowing that we're going to be increasing the numbers of employees, but it does give you an idea that VDH is understaffed and why they're going through the hiring surge for contact tracing.
Next slide. All right, so far we haven't had any emergencies reported through WARN for us. One thing I do want to put out here, since we are doing a WARN update and we're on that timeline, Mike, were you able to get back on with audio?
Yes, I'm on now. Sorry.
I hear nothing from Mike. Mike had posted, just wants everybody to know, the Virginia Rural Water. Oh, okay. Did you want to talk about the Rural Water Conference here real quick, and then we'll get into our new WARN members?
Yes, can y'all hear me?
Yes, sir.
Okay. The board of directors for Virginia Rural Water met yesterday and decided to cancel the 2020 Virginia Rural Water Annual Conference and exhibition scheduled for July the 13th through the 15th in Roanoke. Based on the pandemic issues and not knowing whether or not we would be able to hold the conference or reschedule it, we determined to just keep everybody safe and keep them at home this year. So that's where we're at with that.
All right. Perfect. So I was going with the WARN updates is so far we've not received any official WARN requests. I know Scott Shirley is somebody with a question that came in last week. We do have a couple of new WARN members we'd like to identify. New River Regional Water Authority, Urbana Water Works. And we wanted to talk a little bit. I think we're running out of time, but people need to start thinking about how this is having a cascading effect on supply items, not just those ones that we use inside the industry. The example is the employees at the lumber mills, they're doing the same thing we're doing, and they're load sharing their folks so that they don't have everybody in there. So we're going to start seeing this cascading both in meat. We already saw a little bit of it in dairy, and it's just going to keep snowballing, which will have a domino effect on some of our other resources that we may need inside the utilities. Scott, Mike, I'm going to go ahead and advance to the next slide, but if you have anything you want to say here, go ahead. Scott Smith, if you can go to the next slide, please. Scott Shirley, do you want to talk on phase 1 updates? I may have lost. All right, so phase 1 updates. Face coverings are mandatory if you go inside public buildings. Approaching this new mandate, are you providing masks for visitors when they come on site, especially like in your forward-facing pieces? And how are you informing and enforcing your policies to your staff as we move forward in phase one? Scott Smith, next slide. There we go. So we've got some guidelines on the phase one, phase two pieces with some links. Scott Shirley, are you back on?
Are you able to hear me?
Yes, sir.
Okay. Yeah, the phase one guidance has been posted on our resource page. As we mentioned in the last warn call, surveillance of other industries is really helpful for advanced planning. We'll see other sections of industry, the whole state, moving into phase two. We've posted a link to the governor's guidelines for migration into phase two. In addition to that, as we typically try to do and provide as a summary in these calls, we'll be watching other industries and determining what they're doing for the next phase of recovery, because oftentimes industries receiving some advance notice, depending on the size, such as Walmart. And so determining what they're doing can oftentimes inform us for potential best practices as we all move forward together.
Okay. All right. Next slide, Scott.
This is a recommendation on best practices. We do anticipate that we're all, as we move into future phases, likely to become involved at some point with contact tracing with VDH. We discussed in the last call the VDH daily questionnaires and felt it was worthwhile. We're looking at using one of our technology solutions for customer contact and managing emergencies. It is a software solution that includes an app for interaction with our employees, also deals with lone worker. And so we were looking at presentations and options for that software in the last week, and it's actually being used by a number of localities to complete the daily surveillance of employees. So just want to point out that don't think of everything as a manual activity. Is I would encourage you to talk to your IT staff to meet a lot of these demands and perhaps take some pressure off your supervisors. Ike, you want to handle the next part?
Oh, yes, sir. Next slide. So, this one, Scott, I'm sorry. We jumped ahead. But basically, we want to make sure that as we have people coming in to our sites, especially like if they're coming in to bill pay or discuss a bill or discuss some type of issue, that we're having some way to monitor who's coming into our site. So should we have another outbreak, we have a way to track down who may all have come in contact with those people as they were visiting us. And that was kind of the big piece around that. So we're using our billing system to track who might have been in the facility. We're doing computer surveillance to monitor visitors in and around the building. So this is our cameras and everything, because we want to be good stewards should we have some type of contamination. In this event, when I refer to contamination, I'm talking about the COVID virus, that we're getting that information out to our customers. We just want to make sure we're staying on top of that. Okay, next slide. Kenny Reynolds says, I had a question from a very small utility about when the utility can start turn-offs on water due to non-payment. Any thoughts? Scott and Mike, this is a conversation we've had several times, actually. And that's an excellent question, Kenny. Go ahead, Scott.
It's a fluid situation. Tentatively, the utilities in our region seem to be looking towards the first part of July for reinstituting more typical collection methods. Most utilities are looking at this that we've spoken to as a phased approach where they will ease back into, come up with some type of methodology they can apply. So perhaps you address the most delinquent accounts, highest cost accounts, and then work your way down the list. Although there is a recognition, as we've all seen with the circumstance we've dealt with, things can change very rapidly. And so again, it's tentative, but it does seem, at least for our region, most utilities are targeting that kind of mid-July period for reinstituting.
And I would really look at public perception at that time. Like I would, with everything going on right now around civil unrest, I would probably not want to go out next week starting to turn off water. So keep an eye on the pace of what's going on. We can't produce water forever for no cost, obviously. Where we can, try and work with these small utilities and try to get some pay options in place to help these folks that are falling behind. But it really is going to be a judgment call around public perception when it's time to start turning these off. Is that about right, Scott, or did I overstep you on that one?
No, absolutely.
Another thing I would suggest is that they meet with their governing bodies and decide if they want to play nice with the customers and set up some type of payment plan for them to catch up without actually turning the meters off.
Correct. Because you know that first utility that starts turning them off is going to be the first one in the news. Of course, after that, people start going back to normal business. You just got to make sure you're looking at all the angles. I hate to use the word angles, but you got to look at all the public perception that's going to go around that when it does start. But at some point we have to get back to doing business. All right, I'm going to turn it over to Scott Smith. He's going to talk to you about getting your continuing education credits.
All right, I'm going to try this again. Hopefully there's not a lot of reverb. Maybe?
Yes, sir.
Okay. So real quickly, so we are in the process of still giving out CPE credits for wastewater, water, and engineering credits. So I'm going to put up a poll question in just a second about whether you need to receive those credits. Still in the process of catching up on some of the most recent webinars. I did send out transcripts, I believe, about 2 weeks ago. So if you have received one already, please verify that everything is correct on it. And I'm happy to reissue if we need to. But it will be coming through an outside vendor, Eventful. So you may need to check your spam folder for that. But you can always email me directly. So scott.smith@vaawa.org, and I will process those as I get them. So again, if you sent me one, it may have gotten lost in the shuffle. I will happily digging through and trying to make those corrections. So just make sure that if you do want these credits for today's webinar, do make sure that you fill out our survey that just popped up. Set up for a minute or so.
And Kathy, I see you have your hand up in the chat box. I tried to respond to you. Is there anything we can assist you with? If you want to type it in the chat, we can answer you. Or at the end, we'll have our email addresses up if you want to send us an email question. Let's see. Cyrus is saying, since water is a human necessity, is the federal government open to relief if there is lobby for relief from water utilities? That's a good question, Cyrus. That is one of the items we have talked about in the past. And we are trying to work with those groups that are trying to do that lobbying. We just don't have any solid answers on that. Alan said he didn't get the last or previous polls. So the current poll that's up right now, Alan, is do you wish to receive continuing education credits for today's webinar? And if you do, you got multiple choices. You can choose water operator, wastewater operator, engineering, or none. So if you're not seeing the polls, Alan, if you just want to, all right, so Alan wants water operator. Are you seeing that, Scott?
I got it.
Gotcha, okay.
Yeah,
So Alan, when we get done, I think Scott Smith might be able to reach out to you and we'll get those other pieces taken care of for you. Is that acceptable,
work.
Scott?
Yeah, I got a couple of emails
Perfect.
from some folks who I think had to step out early.
Okay.
And then a couple people have already told me their transcripts are right or wrong, so I can fix those later on.
All right. Do we have the answers on this one, the continuing ed? And then we'll go ahead and close it out and let people get back to their day. So if you're able to see the screen right now, you'll see that both my email address, Mike Lynn's email address, and Scott Shirley's email address are posted. So if you had any questions that got asked and we weren't able to answer them for you during this time, if you can reiterate them with us, and we will track those answers down for you. We don't want questions going unanswered, because if you have them, we're sure several other people have those same questions, and we'd like to get those answers for you and get everybody on the same sheet of music. Go ahead, Scott. Scott Smith, I mean.
Oh. All right. Well, that is this. Anybody has anything else? That'll conclude our webinar for this week.
All right, perfect.
Analysts have anything else? Or guys, Ike, Mike?
No, that should do it. Thank you, guys.
Great. Well, again, thank you guys for attending, and we'll look forward to hopefully seeing how things shape up.
All right, perfect. Thank you.
Thank you so much.